Hi, this is Dr. Bob Dannenhoffer with another of our Facebook Live events. Thank you all for being here. I've heard that there's some watch parties. That's pretty surprising to me, but welcome if you're there. Wearing this is a fashionable balaclava that has a multi-layer mask built into it. I think very comfortable, and I don't lose it as I do with the masks that go around my ears. Anyway, it is October the 9th, and we're going to go ahead and do this again. Again, this is your chance to ask questions. I may not always know the answers, but if I don't, I look it up and tell you later. And if I do know the answers, I'll tell you. As typical, we start at the top and then move down. Still an incredibly active pandemic in the world. So 37 million cases, over 1 million deaths, still very active in India, US, Brazil. We had 352,000 cases today. That's the most we've had ever in the world. And so this is a very active pandemic in India. We're especially worried because it had been in the big cities and they at least have some resources. It's now moving out to the rural and very impoverished areas that really have very little. So it's really quite worrisome there. Really all of South America is really struggling with the disease. And so it is more than a bit worrisome of what is going to happen to us. Remember, disease in the northern hemisphere typically is on the opposite cycle of disease in the southern hemisphere. And so this is really quite a worry. So as we're going into winter, they're coming out of winter, and they've just had a terrible, terrible time. We've started to see increasing cases in France and the UK and Spain. Israel, which had a big increase a few weeks ago, went into a full lockdown about 3 weeks ago, and their cases and deaths are starting to come down. But 352,000 cases in a day is just breathtaking. In the U.S., we're at 7.8 million cases and 218,000 deaths. We had 60,000 cases so far today, and the day's not over. 60,000 cases in one day. You remember we had a peak in the beginning. We then had a quiet time in April and May, then got really busy again in July and August. But now again in September, it's starting to get really high, 60,000 cases. Very active in Texas, California, and Florida. Florida feels like this is kind of over, but they had over 100 deaths today from COVID. Very active in Wisconsin. In fact, Wisconsin has started now to use a convention center where they would do a field hospital if their hospitals would get overwhelmed. There are a bunch of states in the country, including Oregon, that are fairly full in their hospitals, which means that we don't have that much excess capacity should something get worse. There are 22 states in the country with over 1,000 cases yesterday. That again is just amazing. And for the last 2 days, there have been more than 900 deaths each day in the last 2 days. So this isn't just a lot of cases among college students. Don't worry about it, everybody else. These 900 deaths suggest that this is really throughout the population. In Oregon, we're about 36,000 cases, just around 600 deaths in the state. Yesterday was our highest case count ever at 482. And today was not much better at 410. And these cases, many come from workplaces, they're coming from colleges, they're coming from gatherings and travel. So really it's getting to be problematic. In Douglas County, we're 282 cases. We had, as you saw on the state report, 9 yesterday. Now, the state counts the days a little bit differently than we did, but our last 2 days have been our most active days ever. And when I look at it, there are 10 distinct clusters. We have some in the schools, we have one in a long-term care facility, we have them in workplaces, there's some big family groups that are spreading around the family, and still we're seeing cases from travel. So this one this week was almost certainly contracted in Missouri, so that adds to my list of states, like those quarters that you collect that have all the different states. I'm trying to collect all the different states for COVID, not really, but we're almost there. So just a tough time throughout the world and throughout the country. But still, there are places in the world that are doing great. So if you look at the countries that have done the best with this, Taiwan, South Korea, Australia, Hong Kong, Singapore, and add them together, about 150 million people, and they have less than 100 cases. So it can be done, but in those places are really, really quite different from what we've done. We've also been very carefully following the outbreak at the White House. It now appears that it's up to 34 cases, pretty serious. The president out of the hospital seems to be doing well, but Chris Christie and the head of security are both in the hospital. The security person said to be in critical condition. So that outbreak there really did ripple out and really has caused a fair amount of severe disease. I mean, most people have not been in the hospital ever in their lives. I don't think I've ever spent a night in the hospital. So to have this many hospitalizations from this really is important. Okay. Crystal says we're at 31 cases since last Saturday. If I'm correct, anything over 2 cases tomorrow put our schools in danger of closing. The numbers are about correct. Again, the state counts them slightly differently than we do. But yeah, we're very close to that edge, because if we have more than 30 cases per 100,000, since we have 112,000 people in the county, that would be more than 33 cases. We'll go over that. So we hope we don't, but again, it's so incredibly hard to predict. So someone says, any way at your next school meeting you can attend to recommend kids take an extra mask and change them so they aren't so dirty? Yeah, I think not wearing dirty masks is an important thing, although I don't think we've seen any disease from dirty masks. So I think it would be much better if kids just wore masks regularly. And again, kids actually are better at this than adults. And so really, I'd really like it if adults would wear masks more. So Virginia says, in view of the CDC's acknowledgement that COVID is airborne, can you speak to the effectiveness of face masks versus face shields? Yeah, again, this is very controversial. We haven't had previously lots of research on face masks, face shields, face coverings. It would seem that a manufactured mask is probably the safest of the three. A cloth face mask is pretty good. Face shields, depending upon who you read, some say that they are more effective than face masks because they stop 100% of the flow around your face. So if you think of one of the measures of how well this would work is, could you blow out a candle? And with even a manufactured mask, you can still blow out a candle from an inch or two. No way to blow out a candle with a shield. So there's some suggestion that shields might be more effective. Now, depending on whether it protects you from stuff coming in, again, to get around a face shield, the aerosols would have to turn. Now, aerosols can stay in the air, so nobody really knows. Again, the deal on face masks and face shields is any of those out there are better than nothing. There are some people who can't wear face masks because of previous trauma, and for those people who can't wear face masks because of previous trauma, we want to give them something they can use, and in those cases, a face shield is probably reasonable. It turns out that a face shield plus a face mask is probably the most effective, and that's what we do when we have a patient who is sick with disease. Okay, let's go through some things here. So hydroxychloroquine, how could we go a week without talking about hydroxychloroquine? 2 studies, one from Oxford, which is a double-blind control study, showed that hydroxychloroquine didn't work. It was very nicely done, and I think that pretty much proves it. On the other hand, every time we do this, somebody tells me about the Belgian study. So let me tell you about the Belgian study. The Belgian study is a retrospective observational study. That is, things have happened, and you went back on the records and say, who did we give the medicine to, who didn't we give it to, and how did they do? And they found about 8,100 people, and some got hydroxychloroquine and some didn't. The people who got hydroxychloroquine were very different from the people who didn't. They were considerably younger, which is certainly a better you would expect better outcomes, and they had fewer and they had much less underlying heart disease because they didn't give you hydroxychloroquine if you had heart disease. So these groups are not really comparable. The group that was younger, had less heart disease, and took the hydroxychloroquine did better than the group which was older and had heart disease. Is it from the hydroxychloroquine or not? It's really hard to know, and even the authors of that study say this is a retrospective observational study, which should be the beginning, which should make us do double-blinded control studies, which we've done and have shown that didn't work. So Again, I'm sure there'll be more studies coming out about hydroxychloroquine. I would love that it would work. Nothing would make me happier than to come up with a new and great therapeutic, but it's not there. Okay, another thing, Halloween is coming up. We did a PowerPoint kind of video about it, and then there's a video that will go up today about actually how the candy chute works. So if you want to take a look at that, there are two adorable kids and a grumpy old homeowner, so you might take a look to see how that looks. That should be up on our Facebook page tonight. All right, let's see another one here. So Patty says, when do you think vaccines will be available to the general public? So there are 4 vaccines in phase 3 trials. They kind of standardize what the rules are going to be. They want people to be followed for safety things, for the median person in the trial to be followed for 60 days after their second dose. That makes all the sense in the world, right? Because there's lots of things that will come up in the first week, but there's some things that may not come up for a month or 2, and so they want to do it 2 months after the second dose. That means that the earliest that we're going to get any signals on these is the mid of November. I think we've pretty much agreed it's not going to be here by Election Day. So that by the mid of November, we should start to get some signals about how they're going to work. If indeed they are effective, that is, they reduce the incidence of disease by 50% or more, then they'll go out. Now, it may be that of the vaccines, all of them work. It may be that some of them work and some don't, and it's really hard to know. Remember, these vaccines are all new technology vaccines. So some countries used old technology vaccines by using the protein, making a lot of that protein, and then making that the vaccine that your body would react to. That's sort of how we've made vaccines over the years. Seems to be reasonably effective, but it's a little hard to do because you have to make a lot of protein. The other ways to do it is this messenger RNA vaccines, which is the Moderna vaccine, where you give people messenger RNA, which is genetic material. It gets into cells. The cells then say, oh, this is a foreign protein, and they make antibodies against it. And the other one is the other two are adenovirus vaccines, where the spike protein is inserted into the vaccine, into the virus. You then get an infection with the virus and then make antibodies. Since we've never had mRNA vaccines or adenoviral vaccines out for the general public, we're not sure if they're kind of unusual side effects that we can't really anticipate. So I think those safety things are there. So that being said, I think the first doses of vaccine may come out to the highest risk group, which are going to be healthcare workers, by the end of the year. And I think, like Dr. Redfield and Dr. Fauci said, that they'll be there generally for the general public in the second or third quarter of 2021. Now, the vaccine is going to be important because the vaccine will be great if it works and is safe and increases immunity. But it's not going to be magic. It's not like you're going to give it and all of a sudden it's going to be gone. It's going to take a while to get this vaccine. It's unlike the vaccine is going to be 100% effective. So it's going to take a little while for this to get in there. Probably 6 months or so after the general public starts to get it, I think you'll begin to see the vaccine effect. So we still got a while, 6 months or so, that we need to go ahead and do the routine things to go ahead and reduce transmission, social distancing, avoiding groups, wearing a mask. Yeah, so Casey says, is there a concern that COVID could spread into animal populations and be another source for humans? Well, this has been a concern because we know that it does get into, at least it gets into cats, and especially the great cats, lions and tigers and bears, lions and tigers. And we know it gets into there because when this was going through New York City, the animals in the Central Park Zoo got infected. So it probably could go to animals. Whether animals are going to be a hidden reservoir, we do not know. Now, animals are the hidden reservoir for many other diseases, right? So, for example, we think of Ebola. It goes from monkeys to bats to people. And so this certainly could be in other animals, although at this point there's so much in humans that if it is in animals, it's probably just a tiny, tiny fraction. So Dane says, do you see our county going back in levels as Oregon gets more cases? Well, as much as we have lots of cases, Douglas County is still one of the best counties out there. We still have far less on a population basis than almost any of the counties on the I-5 corridor. So yeah, Oregon could start to move back. They added Umatilla back to the watch list today. And so other counties could certainly get added to the watch list. But when we look at the criteria for the watch list, Douglas County is one of the lowest. Because really what they're looking at is the rate of sporadic cases. Now we have both a low rate of cases and a low percentage of our cases which are sporadic. Our team is so great, and I don't brag on them enough. They are so great. They're almost always able to trace back a case to its source, and so that's not considered a sporadic case. So over the last few weeks, our sporadic case rate has been less than 30% of less than 30 cases, so less than 10 sporadic cases. I mean, there's some counties that are over 100. So yes, we might move back in levels, but by the time we move back in levels, almost everybody else will. Yeah, so somebody's asking about the VA, whether these are veterans or workers. Actually, we know the number. I don't know it off the top of my head, and I don't want to misspeak. So I'll look that up and respond in writing. Yeah, so Lori says, I'm a teacher with my door open for ventilation. It's loud and distracting, I'll bet. Is it okay to have cloth or paper vertical blinds to block the noise and view? So again, the more ventilation you have, the better. Actually, there are places in Asia that are totally into ventilation because if you've ever been to Asia, there's a lot of people living in very crowded areas. And so they're really into ventilation. Again, you can ask the HVAC people to know how many air changes you have per hour in the room. And again, you want to have as many air changes an hour as you can. Blinds obviously decrease the air change a little bit, but certainly better than having the door closed. Yeah, so without much, so there's another teacher who doesn't have much ventilation in their classroom. What would I suggest? So again, at least while the weather is nice, opening the windows, if they can be opened, is a good thing. Opening doors, if they can be opened without problems, is a good thing. And the district can go ahead and look at ways to increase the ventilation in the room and to increase the filtration. I think most of the schools have already looked at that. The other thing is, while the weather is still nice as it is now, outdoor school is just perfectly fine. So, my sense that you get the chairs out there 6 feet apart, they can take their masks down, and you can have outdoor school. We think, again, outdoors is an order of magnitude safer than indoors. So Veronica says, how many weeks over 33 cases before K3 shuts down again? How many cases do we have to be down and open the upper grades? It's really, really complicated. I will tell you there's exceptions to exceptions to exceptions, so hard to discuss on air. But what I would have you do is look at the school reopening guidelines, which are on the OHA website or the ODE website. So typically, if our cases go above 33 cases, that is, our rate goes over 30 per 100,000 per week. If it was there, then the next week, then they would have to shut down, and then we would need to be under 30 for 3 weeks before we could open again. So I really hope we don't get there. I mean, although we've had now 2 school outbreaks, for the most part, schools have been going pretty well, and schools especially so important for those younger kids. Okay, a couple of other things. There's some new stuff out about saliva testing. So you remember, for many months now, what I asked for Christmas was a $1 saliva test, and we're getting really, really close. So I saw one today that's based on saliva testing. Looks like they're going to get it down to about $1. How it's actually going to work, we don't really know, but it's pretty good. The other one is this testing called Binax, B-I-N-A-X. So Binax testing is like the little strep test that they do at your doctor's office, or the flu tests that they do at the doctor's office. It's a swab that just goes in the front part of your nose. It gets twirled 5 times, then put in the other nostril, twirled 5 times, put into the card, put a little bit of juice on it, wait 15 minutes, and you get a result, sort of like a pregnancy test result. These are not super accurate like the PCR test, but they're super fast and super cheap. They're only $5 a piece, and the feds bought them all up, so there's no cost to anybody. And they're 15 minutes. And so they will be great for people who are symptomatic who go to the doctor. They're not good, we think, for asymptomatic people because they do have some false positives. So if you're in an area where there's a very low number of true positives, these false positives will really be problematic. And it's probably not accurate enough if you're going like into the ICU. In that case, you probably want to do the really accurate test. But it's going to be great because it should be fast. We got 2 big boxes of these today. So next week we'll start distributing them out to clinics. So your doctor should well have one of these rapid tests, and they can get you the answer in 15 minutes. These are not to be used before travel. And we'll talk a little bit about travel later, but these are not to be used before travel. And this is not the kind of test that you could, for example, screen kids at a school to find out who has it, because some might turn out positive even when they didn't. So are masks still required? Not seeing a lot of them. Yeah, they're still required, and I would agree we're seeing much less of them than before. And this is problematic because, again, the vaccine, I think it's on good progress, but again, it's not going to really make a big difference in the amount of disease we see in the community until next year. And so what can we do? We can socially distance, we can be careful with travel, we can wash our hands, and we can wear masks. I mean, the number of things we can do is not that huge, so people really should be wearing masks. So let me talk a little bit more about travel here. So there are a number of states that are opening up travel, but they say you have to have a test before they go. Personally, knowing the data, probably as well as almost anybody, is one of the most foolish ideas out there. And the reason about doing a test, say 3 days before or 5 days before you travel, getting a negative result, and then traveling is problematic. And it's problematic for, let me give you all the reasons. One is that if you then contract the virus anywhere from 3 days before you get the test until the time you leave, which for most people is going to be a week, it will definitely not show up on the test. And so all of those people who get exposed in the week before they arrive in Hawaii or Alaska, all of those infections are not picked up. The other problem is that there's some people who had an infection months ago and may still have virus, and they're going to be excluded. Don't come, even though they're not at all contagious. And then there are going to be some false positive results, especially with some of the less expensive tests. There are going to be more false positive results, so they can say, you're positive when you're really not. Far and away, the safest thing to do in those places is quarantine for 2 weeks. So when Hawaii did this, they were able to open up travel, and the quarantine for 2 weeks. They really had very few cases. Alaska had very few cases. When Alaska allowed the testing regimen, their number of cases went up, although not huge, but their cases went up, and Hawaii's cases went up. So I really, really don't like the travel strategy. I think it gives people a false sense that they're fine and they don't have to worry about it. And I think we saw that at the White House. You know, people said, oh, I got tested, I should be fine. And as we see, they were not fine. I mean, 34 cases, a lot of cases. I mean, right, they had as many cases in the 250 people were there as we have in the whole county in a week. And so they had a lot of cases and some really bad outcomes. I mean, the president was quite sick, was on oxygen. Chris Christie is still in the hospital a week later. And the security person is in critical condition. So it's a lot of disease. Yeah, so Anna says, I work at a school with no HVAC system. Yikes. I can open windows now, but not in the winter. What are your suggestions? Well, the schools did get some funds in the CARES Act, and you should certainly talk with your school about what we're doing for ventilation in the rooms. Again, the way we look at ventilation is we look at air changes per hour. And again, like the OR is like 15 air changes an hour, which is great. Airplanes actually are at least 15 an hour. And the study came out that suggested that there have been very few cases on airplanes. And I think that's probably right. Very, very few cases on airplanes because the airflow on airplanes is great and they've made everybody wear masks. But you really should talk with them about this HVAC, about how many air changes per hour you have in the rooms, and try and improve that. So again, spacing, better ventilation, wearing masks, all the things we can do, relatively simple things to go ahead and decrease the risk of disease. All right, well, it's quiet tonight, and that is great. I think people are getting really, really tired. And just a couple of things we would say about that. I mean, this is a time especially to be kind. There's some really disturbing stuff with in the news, kidnapping plots, and then locally with broken windows and whatever. This is really a time we have to go out of our way to be kind to each other, because we're not close to done with this. So people who were thinking that when we saw this decline in August, that we would stay low and we were kind of beyond it, really were whistling in the graveyard. And this is going to be a tough winter. What we're starting to see already is an increase, like we see every fall. I mean, this is not a big deal, where people get colds. And so I know 4 people right now who've got a little bit of low-grade fever and a cough. Could they have COVID? We don't know. But they've gone and gotten tested and they haven't had COVID. But during the time when there's so much other background disease of fever and cough, it's going to be really hard to separate out who has COVID and who just has a cold. Now, the Binax testing will help, but nonetheless, I think we're in for a slog of a winter. I don't think we'll get back to the 3 cases per week like we had in August anytime until the springtime. So it's going to be a long time. I know people are exhausted already, but we're just in the middle of October. We're really, really hoping that people are kind to each other. Okay, so what can you do? So you can distance, you can wear masks, you can avoid big gatherings, and you can get a flu shot, because I will tell you, influenza and COVID are really hard to tell apart. And so it'd be great to go ahead and get a flu shot. We're going to have 3 drive-through flu clinics. These drive-through flu clinics are going to be at the fairgrounds. They're free. We're using state-supplied vaccine. We have volunteers in the community who are actually given the vaccines. They should be great. I actually got one of them. So I always try out the vaccines before I would give them to anybody else. So I tried it out the other day, and I had a very special person give me the vaccine. And it was a kid who was in the clinic who was a little nervous about vaccine, so she gave me mine, and it was great. It was one of the best flu shots I've ever had. I had absolutely no reaction to it. So please get a flu shot. So it's on October the 16th, October the 30th, which is the Friday before Halloween, and then on Veterans Day. So Veterans Day is going to have a reverse parade with stationary exhibits and people driving through. We're trying to line up some bands in the stands so you can ride around the track and listen to the bands. And then either before, during, or after, you can drive through in the flu clinic and get a flu shot. And so we're really hoping that people get flu shots this year. Now, the good news, what we saw in South Africa, Australia, and New Zealand, is they had a very low flu year. And so we're hoping that we too will have a low flu year. But those areas were really, really good about social distancing and wearing masks. Okay, so the hours on October 16th and October 30th are from 10 a.m. till 2 p.m. So 10 a.m. to 2 p.m. on October the 16th and October the 30th. You do not need to make an appointment. Although if you are going to go, what I would have you do is there's a program called Dispense Assist where you can enter in your information into the computer and you get this little barcode, and it just makes it so easy for the people who are there because they can just barcode your thing and you don't have to fill anything else in. So Bonnie says, I have more asthmatics since wearing masks. Do you have suggestions? Yeah. And that is a problem. Is there better masks for asthma patients? So people with asthma have disordered airflow. And although most of the disorder is getting the air out, almost all asthmatic patients say, I feel like I have trouble getting the air in, which actually is an issue with masks. For people with asthma, you might want to consider using a face shield rather than a face mask. The other thing that you may want to consider is that they have these face masks that have these little like cages in front that lifts it off your face so that it doesn't have the feeling of pressure there. So you might give that a try. I've got dozens of masks at home of different types. I still kind of like the homemade cloth ones. But you might look to see, for example, Under Armour has one that sits a little bit away from the face. That may be easier. So somebody says there's so many symptoms. What do you recommend would be the biggest reason to stay home from work? So if you have fever, cough, shortness of breath, diarrhea, you really should stay home. So fever, cough, shortness of breath, or diarrhea, you really should stay home. Now, what's that going to do? What that's going to do is there are going to be far more days that you would stay home, right? Because people will occasionally have something like that. And in the past, you might have been brave and go to work nonetheless. I think really this year, people need to stay home. And kids need to stay home too. So although over the last several years, they've been having this attendance initiative where they tried to have kids miss less than 10 days of school this year, that's in a year, that should totally be off this year. Anytime kids are sick, they should stay home. For example, in the school outbreak we had, people went to school sick. So when do you suggest we get a flu shot? Anytime. October the 16th, which is next Friday, is the perfect time to get it. So October the 16th, October the 30th, or November 11th are like three of the most perfect days to get a flu shot. There's a little bit of flu in Oregon. We had our first case of influenza B in the county, so it's out there. So anytime you get it would be great, but October the 16th or October the 30th look pretty darn good to me. Okay, well that looks like it for the day. Is that it? Okay, well that looks like it for the day. Thank you all. Again, be safe and be kind and look at our Halloween video. The good news is we have two adorably cute kids on that, and you get a chance to see how the candy shoot works. So again, Dr. Bob Dannenhoffer, Public Health Officer, Douglas County. Thanks.